The evolution of imaging over my career, what I would say is wow. We started with echocardiography and general nuclear imaging, which have been the mainstay for care, but over time, positron emission tomography, magnetic resonance imaging, cardiac CT, all developed, all ways to improve how we detect disease and improve the care for patients. I'm Dr. Rob Beanlands from the University of Ottawa Heart Institute. My area of research is the application of imaging to understand disease, develop new treatments for patients with cardiovascular problems. So my research career started with my training. My mentors, Peter Liu in Toronto and Marcus Schweiger in Michigan, really inspired me to pursue research as part of my clinical career. Then I returned to Ottawa. We were starting from scratch. There was no positron camera, there was no physicist, no chemist. So basically, those two key elements, the recruitment of Rob DeCamp, our physicist, and the Institute's investment in the camera set the stage for us to really undertake the research that would follow that has impacted so many. Several key areas that are very exciting going forward. First, the role of inflammation in disease and applying this to better understand cardiovascular health. The application of artificial intelligence to better allow us to detect disease and to create efficiencies in care. The interplay of the heart and the brain, the heart and the kidney, dealing with the patient as a whole, and using imaging to better understand their disease and improve their care. I think it's well known that my father, Dr. Don Beanlands, is also a cardiologist and the co-founder of the Heart Institute. It was hard to decide whether that was the path that I wanted to follow, and I actually went as far away from Ottawa as I could, and I came to Vancouver. I trained with Dr. Doris Kavanagh-Gray, who was an outstanding cardiologist and an inspiration. And it was her who taught me that I could follow the path of cardiology on my own and pursue my own career. The only other thing I would like to say is to thank the Margolese family in creating this award. I think it's a real gem for Canada. It is an inspiration to researchers like myself and our teams to continue to always look for ways of understanding disease better and developing the treatments of tomorrow.